joining, we put people forward on a special table, and I'm going to use a massage device that we give to patients on their second visit. It's an acrylic massager, and I'm going to get up in her neck and rub the muscles and get her ready for her adjustment. Chiropractors adjust the spine. If someone uses the word manipulation, I say run. Usually, that's not what you want. If you're hurting, if you have serious problems, you want to get it adjusted properly by a doctor of chiropractic.
Feels good.
Use a handheld instrument to adjust Molly's spine. Is this or this tender when I touch here or here?
A little bit on the right
On
side.
the right side. And I'm getting in over the sacroiliac joint. We have joints in our pelvis, and the sacroiliac joint is a big joint in the pelvis. Most people endure lower back pain, and it comes from a sedentary lifestyle primarily. Here we go. And we'll get that sacroiliac joint working and moving, and I'm going to feel with my fingers and make sure there's no knots in the muscles in and around her hip. And she's got a knot right there in her hip, and she could feel it, right, Molly? Mm-hmm. Right in here, and it's a little tender right here and right here. We'll do some soft tissue work because the instrument not only moves bones, and that's proven through research, but it can also work and help the trigger points around the articulation. So this is the hip joint, obviously, that I'm working on, and I'm feeling with my hands, and I'm feeling knots, and I'm working out the knots in her hip and then around her hip. How's this in the middle when I dig in the middle?
It's a little tender.
That's the L5, S1 junction. There's a disc there, and I'm opening up the disc, and I'm getting some movement there too, because sitting around breaks the spine down. It increases discal pressure, and I'm going to feel with my hands and gently align the bones that hold us up, that let Molly stand. And I'm checking her hips. I'm making sure her legs move in and out easily, and I'm checking the left hip now, obviously. And there's a little limitation when I externally rotate her left hip. So I'm going to work on the muscles in front of her hip to allow for more movement. And then I'm going to check again. And I'm going to do a leg length analysis.